Thanks, Mark. We're excited to be here today. This is a subject I'm personally very passionate about, and I know that Haeli is as well. So we are always really excited to get in front of HR leaders and give you guys the tools that you need to improve mental health at your workplace. So super excited to get started. Just to warm everybody up and to get an idea of who we're talking to, I would love it if in the Q&A box, you guys can just all throw in kind of where you're coming from. We'd love to get an idea of, where people are located. If most of you are in the US, if we have people outside of the US. So I am located in Salt Lake City, Utah, and Haeli is as well. And just to give you a little bit of background on us, we operate basically, it's just an employee mental health platform. So employees can get access to teletherapy if they need to talk to a therapist like Haeli. But they also have tools like nutrition counseling, meditation and yoga, different ways to take care of their mental health outside of just therapy. So it's been really awesome to be able to help solve the mental health crisis in our own little way. But that's what we do here. And I'm the founder and CEO at Nivati. And then I'll let Haeli introduce herself and tell you what she does.
Hi, so I'm Haeli Harris. I'm a licensed marriage and family therapist in Salt Lake City, Utah. I'm also a yoga teacher and meditation practitioner, and the lead counselor, as Amelia mentioned. Excited to be here.
Awesome. Thanks, Haeli. Okay, well, I'm going to start with a story. So this is my dear friend, Shannon. Now, Shannon is a medalist, an Olympic medalist. So she's a professional skier. She did mogul skiing in the Olympics, won multiple medals. And she and I both are mom entrepreneurs. And at the beginning of COVID, she was running an executive, what do you call it? She was running it was an event company that just did team building events. So that's what she was doing. It's called Team Empower Hour. And at the time I was running an on-site corporate massage company. And you can imagine what COVID did to both of our businesses and what happened to us. We just basically went to zero almost overnight. And so she and myself and some of our other mom entrepreneur friends started this group where we would get together, once a week or every other week, and we would just kind of talk through some of the challenges we were experiencing. So Shannon gave me permission to share her story with you guys today. She's a mother of two. She's a ski instructor. She's an entrepreneur, and a brilliant public speaker. In fact, she loves just being on stage and the energy that comes from being in a room with hundreds of people, telling their stories, motivating them, getting them excited. And if you meet her or you've ever seen her or met her, you would know exactly what I mean. She's just that kind of personality, very happy, bubbly human being. We've known each other for a really long time. Our kids play together. We've seen each other through all sorts of things in life. And she and I were sitting in a Zoom a few months ago, and, we're both extroverts, struggling with social isolation. We've got kids. Sometimes they're home from school and doing online school, and sometimes they're in school, and, and then it's like all sorts of things around vaccinations. Do we vaccinate our kids or not? And just the world is just crazy. So she's talking to me about having her kids at home and trying to resurrect her company in the middle of COVID. Just that heart-wrenching pain of this loss that she's experienced from just this entrepreneurial dream that just was killed overnight. Because of that, she had a lot of financial pressure on her, because she wasn't able to bring in the money she was bringing in previously with her speaking engagements and things. And then because of that financial pressure, then it was putting a strain on her relationship with her husband. And, it's just keeps building and building and building. So, not only was she physically isolated and has she, lost something that was dear to her, she was also starting to feel emotionally isolated and experiencing her pain, all alone. So I was glad I was there to talk to her. But she sent us this picture. She texted us this picture. She said that her stress was so bad that she actually had to get a mouth guard because she was chewing on her tongue in her sleep. And these gloves are on her fingers because without realizing it, she just started picking away at the skin on her fingers. And so she put those gloves on to remind herself to stop doing that. She didn't even realize it was happening. So you can see in this picture, she's even smiling. She's making fun of herself because she's just like, this is how bad it is. It's so ridiculous. And Shannon she's the healthiest, most active, most inspiring just happiest person that I know. She actually, does everything right on paper. So she exercises every day. She eats right. She meditates. She gets enough sleep. She does everything that she should to take care of herself, yet she is still struggling. And I share this with you because she has no history of mental illness or any mental disorders. She's doing everything right. And she wanted me to share this story because what she's going through is not unique. There's a lot of people that have never struggled with mental health before that are having problems right now. It's a common human response to this unprecedented amount of stress that we're all under right now. So I'm going to ask you guys our first poll question. So how stressed do you think your workforce is right now? We'll give you just a second to go ahead and weigh in. Is your team not stressed at all, slightly, moderately? Are they very stressed? Are they super stressed? Or do you have no idea? Those are kind of your choices. So throw that up there. And then while you guys are doing that, I'm going to tell you a little bit of statistics and then we'll look at the results. So right now, 41% of adults are reporting diagnosable mental health conditions. That means that anxiety and depression, PTSD, things like that are getting bad enough that they need professional help. They could benefit from working with a therapist. Maybe they need some medication and maybe that'll help. But whatever the case may be, that's almost half of us in this webinar right now are struggling with our mental health. And then if you have those poll results, you can show those. Okay, so it looks like we're in the moderate to very is the most common right now. So awesome. Thanks. You can jump back. Perfect. Okay. So what I want you guys to understand about the state of our mental health right now is that, yes, in the last 1.5 to 2 years, there's been a ton of things added to our plates. There's COVID-19, obviously. Now we've got all these variants running around. There's, vaccination politics. Especially in the workplace, right? HR gets that worse than anyone else. You guys are trying to figure out if there's mask mandates in the office. Do you bring people back? Do you need to make people get vaccinated or not? There's so many considerations and that pressure is just being added on, especially in the HR space. Remote work, there's social unrest, even outside of the US, it's like all over the world, economic uncertainty, politics, and the polarization. So all that stuff is huge. According to the APA, this percentage is what percentage of people are feeling high levels of stress from any of these categories. But what's interesting about that is if you look at the stuff that was already there. So it's not like we were just doing awesome. We were in this great place as a society and then just all this stuff happened and we couldn't handle it. No, we were already on the verge of a mental health crisis before COVID even hit our shores, right? We already had things like shootings, and those are starting to come back again now. Climate change, immigration, sexual harassment and assault, the drug epidemic, suicide rates, especially in kids, all sorts of things. Those were already there. We were already dealing with those and trying to figure out how to manage the stress that was caused by all those stressors. And then COVID just kind of opened up a whole new box and layered it on top of everything we were already doing. So what I want you guys to take away from this is that we were already on the verge of a mental health crisis. And then everything that's happened in the last 1.5 basically just dumped a bunch of fuel on it and lit it on fire. So that's why we're in the situation that we're in right now. So Haeli, I'm going to let you talk about this next section.
So yeah, let's talk about what mental health is. I know a lot of us really have an idea of it, but I always love to bring up the World Health Organization's definition of mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her own community. One of the reasons that I really like this definition is it includes a piece that says can cope with the normal stresses of life. And we just saw the slide that those really aren't normal stresses of life. Normal stresses of life can be some job stuff going on here and there. But I mean, we've had this going on for so many years that it's definitely is going to make an impact on people's mental health and add to these stressors. Mental health has to do with our mental, our emotional state of being, and it significantly impacts our lives in various ways. Various factors can also impact a person's mental health, such as a family history of mental health problems, genetics, brain chemistry, life experiences like upbringing, trauma experiences, or significant stressors. So knowing mental health, I'm curious, here's our next poll. How big of a priority is mental health at your companies right now?
And then I just want to, while you guys are filling that next poll out, if you guys have questions, please feel free to throw those in the Q&A. We see those as they come in, and we'll address some of them during the presentation, and some of them we'll address at the end, just depending on what the question is. But one of the questions from one of the users on the webinar, James Fleming, asked if our therapists are LPC, LMFT, or LMSW. So I'll let Haeli answer that while we're taking that poll.
We have LPCs, LCMHCs, which are clinical mental health counselors. It always just depends on the state what their title is. We have MFTs as well as LMSWs, which is a licensed master social work. We also have LCSWs, the licensed clinical social work. LPCs is for licensed professional counselors. So it just kind of depends on what state they're in, what their background, what their master's degrees are in, and their training hours is what licensing they have. And they're all qualified to do clinical therapy.
Awesome. And we want to see those poll results. There we go. Cool. So it looks like important or above for most people.
Yeah, that's great.
So, and then there's a handful that maybe it's not a high priority or they just don't know. So that's good. Looks like it's on the docket. So the statistic around mental health, according to SHRM right now, is 92% of companies are expanding their mental health benefits right now. So that study just came out in August, so it's only a couple months old. But yeah, you're in good company. You're not alone. There's a lot of companies that this is a high priority.
Yeah, which is definitely something it needs to be. One thing to know what mental health is not. Mental health talking about mental health problems doesn't mean necessarily like that there's something wrong with you. It doesn't mean that you're broken or that there's loss of hope of getting any kind of help. It's just really important to remember that because you're struggling with mental health, it also doesn't mean you have to have a mental health disorder, which we'll talk about in a little bit. So going to the next slide, why does our mental health matter? It affects so much of our lives in various ways that a lot of people don't even realize. Your mental health is going to affect the way that we feel and the way that we manage how we feel. It also affects the way that we think and what we do with those thoughts, which is our behaviors, right? It changes how we react to things. It changes how we react to the emotions and to the thoughts, what's inside of us, as well as what's around us. And very importantly as well, people do not realize this, that mental health is directly correlated to disease and to our overall physical health. So your physical health will impact your mental health, and your mental health will impact your physical health. And it's really important to know those things. And so we have this problem right now with mental health. Okay, yes, we've all seen this huge increase and this huge spike. And as Amelia just mentioned, all these companies are now starting to expand their mental health benefits, which is so crucial right now. This is from the American Psychological Association. We are facing a national mental health crisis that could yield serious health consequences for years to come. So what we are planning for in the mental health field is we know that people are struggling with their mental health right now, but we are planning to see the effects of this for about 10 years and the way that it's going to impact people's mental health and the normal developmental process for people with their mental health.
So I'm going to talk a little bit about why this should matter to you as an employer. Why is it such a big problem? Why is it such a priority? Should companies even really care about their employee mental health? I think everyone would answer a resounding yes for the most part, but let's talk about why that actually matters. So what's super interesting is that mental health is expensive. It is now the most expensive in economic cost of any illness, disorder, sickness, whatever you want to call it. The words are kind of interchangeable, but mental disorders make up the biggest bulk of that. So even more expensive than cardiovascular disease, diabetes, respiratory disease, cancer, because negative mental health feeds into all these other sicknesses and all these other things. So it's just, I mean, there's so many studies that even just show that stress makes everyone sicker and increases all your health challenges as well. So just the number one contributor to anything that we're dealing with. So it is super expensive from an economic standpoint. It also causes challenges for employers in burnout, and, you know, caregiver fatigue is a big one right now, where a lot of people are taking care of, you know, their kids and their parents at the same time. And then you've got things like substance abuse and other things that aren't necessarily trackable in this same way. It definitely affects performance. This is probably one of the biggest things that can actually be measured for employers. So between absenteeism and lost productivity, we're seeing an average of almost 35 work days lost in a year. So that's about 7 weeks. And that's just looking at some of the more common mental disorders, mental illnesses that are out there right now. So this doesn't even count things like destructive leadership, negative interactions with peers at work, and just that detrimental effects that poor mental health can have on things like culture and morale across an organization. So it's definitely a big problem that we need to address in the workplace. Oh, there's your average days lost. Okay. And then, so the other reasons, there's been a lot of studies out there showing that there are lower productivity levels, increased missed days, less quality of work, all due to mental health. But the kind of the three key challenges of how it negatively affects the workplace is just the inability to concentrate, right? If we are struggling and we are super stressed or we're feeling depressed, it's really hard to get your work done. And when you do it, you know, they're finding that there are a lot more errors and problems with the quality of the work that's being done. And then sleep is a huge one. Haeli will talk about this more when she digs into some of the common mental health challenges, but even depression and anxiety both result in sleep disturbances. And if you're not sleeping well, your productivity goes down, you're making more mistakes, and you're, you know, less productive at work. So, and then of course, what Haeli kind of already talked about is just physical issues and chronic illnesses. It just is a magnifying glass for making those things, you know, worse and really accelerating any kind of issues that are already there. So our next poll, and what we want to understand from you guys, is how do you guys currently support employee mental health? Do you have an EAP? Do you offer a teletherapy platform like ours? Do you have flexible work options? Do you let people take mental health days? Do you have, you know, a mindfulness benefit or something like that you're offering to try and proactively help employees with their mental health? Is childcare important for your team? You know, what's paid time off, or, you know, any of those. So while you guys are thinking about that, I'm going to share another statistic with you. It's pretty mind-blowing, but out of the 41% of your employees that probably need professional help, half of them will never get the help that they need. So they will never raise their hand and say, I'm struggling, I need to talk to someone. And I'm going to tell you why in just a minute. But first, let's look at the poll results. Okay, so it looks like a quarter of you guys have EAP. Multiple of the above. Okay, so probably everybody has EAP if it's multiple of the above. But childcare services. Okay, cool. You guys are just still filling it out. That's great. Mental health days has been interesting to see too, because there are a lot of companies, a lot of the clients we work with that'll just let their employees take mental health days. We'll talk more about other cool things that you can do and what we've seen some of our clients do really well, but those are great results. I'm glad to see that you guys are coming at it from multiple angles. So if half of your employees are not going to get the help that they need, let's talk about why. So there are two categories of barriers to getting the care that you need. The first category, which affects about a quarter of employees. So this is a study done by the World Health Organization. So these are people who need help but aren't seeking it. And about a quarter of them, it's things like cost, lack of availability, which is a huge one right now, because if you try to go through your insurance or you try to go through your EAP, and we're looking at 2 to 3 months of wait time before you can get in to see someone. And if you need help now, if you're feeling depressed or you're feeling suicidal or your marriage is struggling and you need help, it's like, you do not need help in 2 months. You need help today. So that is a barrier. If people can't give in, they just give up sometimes. And transportation, inconvenience, like maybe the location's not near you, things like that. So definitely as an employer, being able to provide it for your employees makes it a lot easier. Even if you have really good mental health coverage, if you have a high deductible or the copay can even turn some employees off from using it. If it's like $25, not everybody has that. So we need to be mindful of that. But that affects a quarter of employees. And if you look at the big one, this affects 96% of people who do not access care. And this is really interesting because if you look at it, stigmas, okay, people are like, I don't, have a mental illness. I don't want to talk to someone. Well, you don't have to be diagnosed mentally ill to need to talk to someone. So there's a lot of stigma that, you're broken, can't feel happy on your own. I know personally, there was a time in my life where I had to go on depression medication that I sometimes share in these things. And I was devastated because I thought, oh my gosh, like I can't even feel happy on my own. What is wrong with me? And it turned out that's not the case. It kind of opened my eyes. I'm glad I had that experience because I was like, oh, okay, there are tools out there to help you. And for some people, that may be talking to somebody. For some people, that may be taking medication for a little while or even permanently, and that's okay. So stigmas are something we really need to address and we need to talk about it. Employees have a ton of concern around people finding out. They don't want their employer to know if they are having anxiety or depression or something like that. And then the rest of it is just like, they don't really understand how effective mental health care can be. Or maybe they think it only has to be really serious to talk to someone and don't realize like, hey, if I'm just feeling overwhelmed or burnt out, talking to someone could help. So what's cool about these attitudinal barriers though, is if you look at them, these are all things that we can solve with education. So stigma, communicating to your employees that everything is HIPAA compliant and confidential, and there's no way their information could be leaked out to you, right? It's just, how do we over communicate all these things to our employees in a way that we can overcome all these barriers? And that's what's cool. 96% of people don't get care is because of any of the things on this list, but we can overcome those, and we can overcome them in a low cost, very simple way of just educating and communicating to our employees. So that makes me very excited.
So let's talk about what you can do, what we can do to best support our team in helping break down these barriers. Let's start with another poll question. Have you ever talked about mental health with a team member? While you guys answered that, that was quick. I'm gonna actually, okay, there we go. Yes, just more than half. No, not sure. Okay. Well, I like seeing the yes become higher. It's definitely something that's getting talked about a lot more today. A little bit changing there. Yes, going up.
It's kind of fun to watch them change in real time, actually.
Yeah.
There's something very satisfying about it. I'm like, oh, this is cool.
And then it's going down. That's okay.
Looks like most people have had to talk with a team member. I wish we had another poll where we could ask, have you ever been trained in how to talk about mental health with a team member? Because I think that's a big problem. It's most people in HR and even managers are having these conversations with their employees all the time. And most people don't have any formal training in how to communicate with employees about this. So that's something Haeli's going to talk about.
Yeah, so let's talk about how we can remove these barriers. The biggest piece is going to be by removing the stigma. There's a few ways that we can do this, and we're going to talk a little more in depth about each way. So shared normalizing, easy accessibility, providing options, and proactive care. So let's dig in and start with sharing and normalizing. This is one of the biggest ones that we can all have a role in. The ways that we can do this include learning about mental health, which we're doing here, and we'll do some more, and you guys can always do this. Talk about it, which sounds like a good portion of you are. And if you aren't, I encourage you to start, but definitely not required. We've also seen that it really helps to get leadership starting those conversations and having those conversations. There's a lot of studies showing the way that the higher up and the leaders talk about this, the more the employees feel safer about their mental health problems. Teach it through trainings, workshops, train the managers on how to have employee conversations around mental health. Have discussions around the various type of help options. There is not just one, go to therapy, which we'll talk about in a little bit. Communicate that it's confidential to talk so that they feel safe. We saw that one of the barriers was that piece of not feeling like it's going to be confidential, that it's going to affect their work, their job. And so that is a big thing that really needs to make sure that's done, as well as providing mental health days. When we actually say we're providing mental health days, it says, hey, you know what? This is a struggle for people. So let's talk. This is a way of us talking about it. You can have these mental health days. So we really do see that when those things are done, it does help people to be able to destigmatize their struggles with mental health. So let's learn a little bit more about it, diving into some of the most common mental health issues that we see. Common conditions include depression, anxiety, post-traumatic stress disorder, or PTSD. But mental health issues can also include other things like substance abuse, suicidal ideation, relationship distress, and domestic violence. Remember, we do not have to have a diagnosis. You do not have to be diagnosed with depression to be struggling with some depression. We see that often, and there can be mental health issues without actually having a diagnosis. So we're going to dive into each of these three just real quick, talking about recognizing depression, because if we think about these back to those impacts on the workplace and how it's affecting people at work, we'll see how these symptoms kind of play into that. Depression includes a diminished interest or pleasure in activities. So loss of interest in doing things, a lot of loss of motivation to do things, appetite disturbances, either eating too much, not eating at all, and same with sleep disturbances, either eating or sleeping too much or not at all. Often we would see more sleeping when it comes to depression. Psychomotor agitation is moving so quickly, or the opposite, that could be moving so slowly. It's like they don't even realize it usually. Fatigue or loss of energy, feelings of worthlessness, diminished ability to think or concentrate, and recurrent thoughts of death. And then when we talk about anxiety, so anxiety includes excessive worry, restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. We see sleep disturbances again, usually anxiety, they have a difficult time falling asleep or staying asleep. So if we notice things like having those the sleep disturbances, which we saw impact the workplace, difficulty concentrating impacts the workplace. People are very tired, easily fatigued. Those are seen in both anxiety and depression. That's going to impact how they are at work. Irritability is definitely one that we also see in depression too. I definitely see that one as well. So these things all are going to have an impact in the workplace. Now, one thing to note with anxiety, I cannot remember when this was done, but anxiety, I want to say this was last year. I saw that it was the most common health disorder in the US, but it's also one of the most treatable disorders. Those suffering from anxiety are more likely to also struggle with depression symptoms. And those with anxiety are 3 to 5 times more likely to have to go to a doctor. So again, we're seeing that physical piece. And 6 times more likely to be hospitalized for psychiatric care than those that don't have any anxiety symptoms. So it definitely impacts a person's ability to work. And then lastly, we'll talk about recognizing PTSD, post-traumatic stress disorder. definitely have seen this increase over the last year and a half, as people have gone through quite a bit this last year. These include things like recurrent unwanted thoughts of the traumatic event, nightmares or upsetting dreams about it, getting emotionally distressed when something reminds them of the event, or also a physical reaction when something reminds them of the event. A thing to note with PTSD is the person doesn't have to physically experience it in person. It can also be something they saw, or if like someone they really care about also experienced it, then it can happen. They can experience PTSD symptoms. But what we often see with PTSD is they get these negative thoughts about themselves. So now, as well as the hopelessness about the future. So now we're seeing depression symptoms kick in. They also have a lot harder time with relationships, because often they detach themselves from family and friends, which are often our support system. So
one of the things I've heard you say before too is that it's not necessarily just people like getting PTSD from the stuff we've gone through in the last year and a half, even though that is something that's happening. It's people that maybe had it before, and all of the stress and strain of everything that's going on is making it get worse. Is that how you describe it?
Yes. Thank you, Amelia. It is definitely something we saw, that especially at the beginning of the pandemic. A lot of things that were happening had triggered, not my favorite word, but had triggered people's PTSD, that when they had gone through previous experiences that they were feeling were in a good place, which that happens, and unfortunately with PTSD.
And then we do have another question. They're wanting to know, the providers, do they need to be licensed in the state the client is in, or, are they state-based or national licensing?
So to practice clinical therapy, they are licensed in the state where the client is in. Currently, there are no national licenses for clinical therapy work.
And it's kind of a weird thing where legislation hasn't really caught up with it yet, because it's based on the residential address of the person who's receiving therapy. Mm-hmm. But as we know, everyone's just living all over the world right now. They're in all these different places. So I'm hoping that legislation catches up and starts building out some sort of licensure where people can practice in multiple states, because right now people are transient and just working from anywhere. So if you went to go visit Hawaii, for instance, and you were struggling and feeling anxious and you wanted to talk to someone, you could go see a therapist in Hawaii. You wouldn't have to fly home and then talk to somebody there. So it's just the laws haven't quite caught up with the reality of the world we live in now. But currently it is a state licensure, and it's based on where they reside, not necessarily where they are currently present.
Correct. Yes. Yeah. It gets difficult with that. So let's talk more about, we know the struggles now. We've understood the symptoms and the kind of things that people could be having problems with. So what can we do to help an employee? Some of the best ways to support a team member is, one, what we just did, understanding the signs and symptoms. We've said this before, creating a safe, confidential space. Encourage the employee to share their feelings and their emotions, what they're going through. Use good listening skills, learning what to say and not to say, which we'll talk about in a minute, as well as taking care of your own mental health. You cannot help others unless you are helping yourself first. It's like one of the number one rules as a therapist. And providing employee education. So again, we're talking about it, we're sharing the information and talking more and more and more about mental health. So how to communicate. Here's some things that we can say versus things that we maybe don't want to say. And I'm going to start with the what not to say side. Why don't you just snap out of it? Stop thinking those kind of thoughts, move on. It's all in your head. Just look at the bright side. Why are you being so negative? I think you're being too sensitive. Why do you let yourself feel this way? These are things that are actually can be very detrimental to a person that's actually struggling and trying to get help. It will usually create more of a roadblock for them to get help and not want to get help if they hear some of these kind of things. It diminishes how they're feeling. And so then they're kind of like, oh, I shouldn't be feeling this way. So we have some ideas on what to say. I'm here if you want to talk about it, or whenever you're ready. What can I do to help or support you today? And I think that's actually one of the best questions we can ask someone is, what can I do to help? How are you coping? I wanted to check in with you. I noticed you've been distant, down, or sad, or whatever. What is concerning you today? Has work been stressful for you lately? I also think that's another one that's important, because a lot of employees are not just going to come up and say that it's been stressful for them. And what do you do to take care of yourself? So really checking in on that self-care and how they're coping, which we'll talk some self-care options in a little bit. So some of the mental health best practices when talking with others: educate yourself. There are so many now mental health resources out there. We have a blog where we talk a lot about various different mental health topics, the ADAA, NAMI, there's one called Psych to Go, and also encourage the employees to get that education as well. I mean, if you don't feel comfortable talking about it yourself, you could always offer them some kind of like, hey, I found there's this site you could go look at and see if they have any resources for you. And just by doing that, that's a way of helping somebody. Setting the example. So show employees that you prioritize your own mental health by having very clear work-life boundaries. I know a lot of us have gotten so bad at this last year. So this could look like maybe not responding to emails on the weekends or outside of work hours. And even better, start talking openly about mental health around your own employees. So it's so helpful when somebody starts the conversation and say, I'm struggling with this, because it makes it a little bit more normal for a person to be like, oh my gosh, I'm not the only one. Or, oh, somebody else that I know has this issue that I work with, maybe they, could talk to me. Establishing a meditation time for your team. So if you're working in person, you can meditate together. Or if your team's virtual, you can challenge the employees to meditate and then maybe have some kind of forum where you guys talk about it, or get online and meditate together. It's really a simple way. And I love when companies, I teach meditation with Nivati, and I love when the companies book a session with me and it's a whole bunch of the employees there online. And ask employees like how they're actually really truly doing. This is best done in one-on-one sessions. So setting a time to have those one-on-one sessions to talk about not just their work, but also their mental health. Make it clear that you're wanting to help them succeed. And if we want them to succeed at work, we need to be talking about their mental health as well.
And I would also just kind of illustrate this too. So some of the companies we've seen that do it the very best and have the best culture and, happy employees that are sticking around and have great retention. When it comes to setting the example, if you can get the CEO or even as an HR leader to open up and say, this, even if it's something in your past, doesn't have to be something you're struggling with right now, but sharing stories about your own challenges or struggles. When you're vulnerable, it gives other people permission to be vulnerable too. And then if that comes from leadership, that gives everyone below them, in the food chain, the permission to also struggle. So it can be simple things like, if your company uses Slack, setting your Slack status to, taking a mental health break, taking the dog for a walk, need a few minutes to reset, or something like that, right? And those send signals to your team, and they see that, they're like, oh, so-and-so is doing this. It's okay for me to do that. Or, just taking the day off and autoresponder, take a mental health day or something like that. But those little signals, even though they're just tiny little things that are not hard to do, just require a little bit of vulnerability on your part or on leadership's part. And that sends messages to your employees. And that begins to slowly and incrementally change the culture in your company and really eliminate the stigma associated with mental health. So, and then the other thing I would add to that is, yes, the one-on-one times with your employees. And this is something to teach your managers. And we do a ton of manager training. So let us know if we can help out at all. But if you can get your managers in a room and walk them through, those questions of what to say and what not to say, and how to ask the right questions to employees so they can really get a good temperature read on how employees are doing, not just with work performance, right? The point of a one-on-one is to connect with your employees. And, that also gives you as the manager the opportunity to see any red flags that might be coming up and, head those off before it's too late and an employee's leaving. So, I've had just so many experiences where if I had not asked those questions and I had not been religious about doing my one-on-ones, that I would have lost employees, because by the time the information gets to you, it's too late and they've already made the decision to leave. So definitely taking the time, asking the right questions, always making sure those one-on-ones happen and those employees know they're a priority. And that is how you're going to stay connected to them. But I just wanted to throw that in there.
No, I appreciate that. And I think you're up.
Oh, okay, cool. So we're going to talk about some other strategies for eliminating the barriers for access to mental health care. So a huge one, I mean, if you look at going through insurance, let's just talk about insurance for a minute, right? You've got co-pays, you've got deductibles, you've got wait times. It's never easy to find a provider, even with the best health insurance companies, going online and trying to find somebody, right? Everybody wants to work through a referral, and that takes a ton of effort as well. So just the insurance experience is laden with friction points, and all those friction points give employees a reason to not get the care that they need, and they'll turn away. Because going out to get mental health care is scary enough on its own that it's its own deterrent. So if we want people to feel comfortable and to move forward and get the care that they need, we need to eliminate all those friction points. So that's the health insurance experience. It sounded like most companies had employee assistance programs. I'm sure you guys are very familiar with them, but there is a million friction points there too. I mean, the typical experience that our clients have when they explain it to us, it's like calling a 1-800 number. Well, let's not forget you have to go to HR in the first place, because nobody hangs on to the EAP information. So a lot of times they have to approach HR, say, hey, I need our employee assistance program information. And that right there is going to deter most of your employees, because they don't want HR to know they're struggling. So if they do get the strength to go to HR and ask, then they have to call this 1-800 number. They have to talk to someone who's not a licensed therapist and spill their guts and say, this is what I'm struggling with. And nobody likes to do that. And then they get a list of names or clinics. They have to call them all. There's wait times. I had a client describe to me the other day that when they went into their EAP appointment, it was like they drew a name out of a hat, and just whoever was there that day just showed up. So there's been, another friction point is that lack of ownership over your own care. People want to work with someone that they know has the same background with whatever they're struggling with, who can really help them. So, that's a problem. And then you hit your 3 sessions, your 5 sessions, whatever it is. And it's like, okay, well, that's all you get. So now you need to start all over with somebody new in the health insurance process. So, I mean, if you just look at the way we've been doing it, like giving employees access to mental health care is awesome. And it's the right thing to do. The way it's been done traditionally and historically is just a broken process. And it's just, there's so many friction points that people are not getting access to what they need. So that's my soapbox. And so really the way to win and the way to get your employees what they need is to make sure it's just super convenient. Depending on the demographic of your team, if they're a younger demographic, text and email and chat, all of those are really popular. I know my little sister's 25, and I know she would much rather text her therapist than show up and have to talk to someone face to face. So think about your audience, the people on your team, and kind of what box they might fit into and what types of therapy might resonate with them the best. Also, mental health is a lot more than just therapy, right? I have a slide about this in a minute, but it is not a one size fits all. So besides accessibility, we also need to be providing options. So some people prefer to talk to someone in person. If you have, a demographic that's more appealing for them, then make sure that you have the ability for in-person. If they prefer to just do it over Zoom, make sure you have that. If they don't want to talk to anybody and they much rather watch a video, it's really interesting. If you look at the data on our platform, we have people that access therapy and then people that watch videos on therapy on that same subject, right? So maybe your teenage daughter is struggling with depression. You're going to watch a video on that before you talk to someone, or maybe instead of talking to someone. So we really have to have solutions for them that meet them where they're at. Because like I said, mental health care is such an uncomfortable thing in the first place for people that maybe they don't want to talk to someone face to face, that feels shameful, they feel embarrassed, but they'll watch a video on it, or they'll download a PDF, or they'll talk to a robot, right? We're launching our chatbot in January. There's a ton of research that shows that people feel less judged when talking about their mental health with a chatbot versus a human. And so people are more apt to maybe be open and completely honest with a chatbot versus a person. So these are just things to think about. There's not a hard and fast rule that you need certain types of options. It's going to be very dependent on your employee base, but the key being you need to make sure that there are multiple options, because there is not a one size fits all solution for mental health. And then this is something else that we have learned over the last little while. Not everybody's open to therapy. Obviously, there's a stigma around the word. People are afraid of it. But some people will talk to a coach. So coaching is kind of like the step before therapy, where maybe you'll capture some of your employee base if you're offering coaching and therapy, and they'll do different things. And, not everybody's going to be into meditation, but you can kind of start with breathing exercises. Breathing is not so scary. We all breathe. And Haeli does these really great breathing exercises that I learned when I went through our first cohort. We run an HR support group, which I'll just tell you, it's free. It's a 4-week cohort. Haeli runs it, teaches you how to manage your own anxiety, as well as digging into kind of some of the details of managing those conversations with employees, recognizing different challenges they may be having and how to support them. So just, I went through the first cohort. Haeli taught me box breathing, and it's something I actually use all the time now. So you can kind of look at it as baby steps. There's like breathing, and then maybe meditation, and then maybe some people will do yoga, and just like the relaxation at the end is as close as they can get to mindfulness. And there's coaching and therapy. So again, diversity in tools that you're giving your employees access to, and different things are going to appeal to different people. All right, Haeli.
Okay, I'll go over just this real quick, because as Amelia showed in that last slide, those first 3 things are kind of around mindfulness, and then coaching, therapy. So mindfulness is actually used in therapy. This definition explains it: calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, used as a therapeutic technique. So we use mindfulness to help with depression, anxiety, ADHD, PTSD, and other stuff. We definitely use it, and it's used in actual evidence-based practices, which means, so we can only use evidence-based practices in therapy, in clinical therapy, and those have to have been studied and researched for us to be able to use those. Ways to practice mindfulness include things like doing yoga poses, doing meditation, mindfulness exercises, and using the breath work. We definitely have found a lot in studying mindfulness that it shows a positive impact on mental health conditions. It actually reduces symptoms of depression and anxiety, and it's linked to more positive health behaviors. So mindfulness is definitely a great way to get started with, hey, how do I even start talking about how helping somebody to get help? Can definitely be like just breathing exercises.
And I think that's a great point to make too, because I think when you think about mindfulness, it's just like, oh, it's kind of like this fluffy, frou-frou, maybe millennial thing or something. And it's like, no, this is actual like clinical stuff that has real outcomes. So I think that's a really interesting point to make.
And then finally, we'll talk about the stuff we can do that is proactive care. This list includes many things that therapists would suggest for you to take the best care of your mental health. So we have psychotherapy, or some people call it talk therapy. There's coaching, breathing, meditation, exercise, nutrition, fitness, sleep, and self-care, which I'll talk a little bit about self-care on the last slide. But these are definitely things that you can talk to employees about doing before it gets to a point to where they are having these major struggles. People can do therapy without having a major mental health issue. They can still do it proactively. So tools for self-care. Self-care is doing things that help you recharge, that help you feel better. It's part of that proactive stuff too. These include things like the healthy diet, regular physical checkups, which a lot of people got behind on during the last 2 years. So go get those done. Making sure we're getting exercise or some type of physical activity, having a healthy sleep hygiene, taking time to relax, allow yourself to relax. It's okay. Having that healthy support system, looking at who is your support, keeping regular schedules, reading, journaling, turning your phone off, which is part of having healthy boundaries, taking time to decompress and to do the things that you enjoy. And I would throw in there, do those things mindfully, like enjoy those moments for sure.
Okay, now we can open it up to questions. If there's any other questions, let's get those in the Q&A box right now. And then, yeah, if we see any questions come up, we can answer those. If you guys are interested in these slides or our mental fitness toolkit, you can just go to nivati.com/mental fitness toolkit. You can scan that QR code on your phone right now on your screen if you want to. But yeah, we have a free mental fitness toolkit. I think it's like 15 pages with like real actionable stuff and actual case studies from stuff that some of our clients are doing. So people really love that tool. We have a few other tools. You can email me or Haeli directly as well. Our emails are right there. If you have any interest in being part of our HR support group, that's totally free. Our next cohort will start in January. I'm happy to add you to that. It's fun because you're going to be with other HR leaders across the US. We also have a brain trust for HR leaders. If you're VP or above, then that is kind of it's a higher level HR organization. We get together once a month. We talk about issues that you guys are experiencing. We're just a facilitator. It's not mental health specific. So you guys get to decide what topics you want to discuss with your peers. And that's pretty awesome. That's once a month. And then we have an employee survival guide and a manager training handbook as well. If you guys are wanting to help your individual employees or your managers beef up their mental health tools as well. So anyway, those are the resources we have. Let us know if we can help you guys in any way, and I'll turn the time back over to Mark.
Okay, so we have time for a few questions in addition to the ones you've already answered.
Okay.
With the costs of everything going up everywhere, what should someone do if they can't afford therapy or if they think it's too expensive?
Definitely look at the insurance and EAP options because those are going to be very low cost, and see what your company offers. Then there's also finding resources through different websites. I know there's some companies that offer very low cost like chat services and those types of things. And then looking at your support system, that's really important, and who can you talk to in the support system that could be of help for you when you're struggling.
And if it's an individual person, I mean, there's the suicide prevention hotline, and there's what's the other hotline? The one you can text.
There's a texting hotline. There's a domestic violence hotline, an eating disorder hotline. There's a lot of different types of hotlines out there.
Yeah, and those are all free. So if anybody is curious about those, we have a slide we can send you. Just shoot us an email. We can send you over those free resources as well.
Great, thank you. Also, how does somebody know if they should get professional help? What are some warning signs?
I would say first, if you're starting to kind of question if you need some help, then definitely get some help. But generally how we look at mental health disorders is if it's interrupting your regular daily activity and for the length of time. So if after like a week or so, a couple of weeks, you're still really struggling, definitely go talk to somebody.
Thank you for that. One last question. Does therapy really help? And if so, how long does it take to work?
Therapy can definitely help. I know it doesn't work for everybody because it has so many variants in it, but it can definitely make a positive impact. The length of time is really going to depend on what you're struggling with and the work that you're doing outside of the therapy room. We can't just go to therapy once a week and expect our life to change. We have to be doing other things outside of therapy. And I've had some clients that after, 2 to 4 sessions, they're feeling better, and some see me for a year. It kind of can vary.
Thank you so much. As we wrap up, I just want to, first of all, thank you both for some really good information. And a quick reminder for HCI members, today's webcast has been approved for both HRCI and SHRM credit, as well as for HCI recertification. Your credit for attending this webcast will soon show up in your My HCI profile under the transcript tab. And while you're there, remember to check out hci.org for more insights, as well as information on our certifications, our virtual conferences, our premium membership, and more. Thank you so much to both Amelia and Haeli, and to our friends at Nivati for this great presentation. And thanks to everybody for joining us and spending the time with us. We'll see you next time.